your training course. The reason being is so many people have back pain, right? And sometimes you might be learning an asana and they say, oh, this is good for back pain, this is not good for back pain. Cobra is very good for back pain. But then to prevent back pain, if you have back pain at the time, it can make it worse. So it gets quite confusing as to what is actually helpful for the person who has back pain at the time and the person who doesn't want to get back pain, right? So some things we want to be thinking about which can affect back pain, mostly seen between ages 35 and 55. That is common, but then a lot of people that are younger can also have back pain, okay? Depending on their job, many times, but even teenagers, many teenagers are now starting to get back pain, and it's fairly common in one's 20s as well. Generally equal amongst men and women, higher amongst smokers. Not really sure why that is. To me, I would think, the person that is smoking is generally not following a very healthy lifestyle. If they've chosen to be smoking, then they're probably also doing other things as well. So it's just something to consider. People that are having lifting and twisting jobs, okay, where they lift, where they're turning around a lot, if they drive as an occupation, and of course to add to that, people in the office, okay, people on computers all day long. That's also very, very tiring for the back, and many times their posture becomes very bad because of this. Okay, so many different types of jobs are going to affect the spine, and that's why it's really helpful when you take a case for your students that you ask them what their occupation is. That will give you an idea on how their body is going to be. So some of the causes of pain include accidents and trauma. Okay? If we've fallen over, if we've been in a car accident, so on, many things can attribute to this problem. It might be that you had an accident when you were 20 years old, a car accident, and then everything, it healed and everything was fine for another 10, 20 years, and then the pain started coming back. This is very common. That will happen, and generally it's because that part of the spine that was damaged starts to get arthritic, okay, it starts to degenerate, and then the problems they must have to face. Then it might be the disuse of muscles, so using the muscles in the incorrect way, okay. Sometimes we're overloading certain muscles, or we're using muscles that are not really meant to be used for doing certain things. Then we have the lack of use of muscles. So those that are not getting very much exercise are only using certain muscles. You see that next point, overuse of muscles. So not having the correct balance in the body. What is the tendency is that we use our larger groups of muscles in the spine, and we don't use the smaller muscles very much. And there was some interesting research one of our teachers did. He was a doctor, and he was checking his patients, and he started to do scans on them, and he was getting them to do different types of asanas and checking how they could start to use all of their muscles instead of just putting all the load on the main muscle groups. And he found that when they started doing all different asanas, especially the twisting asanas, that the back pain reduced to a huge amount. So we want to be using our whole body in the correct way. We don't want to just be using some muscles and letting the others start wasting away from lack of use. Okay? It can be poor strength, and also stability. Okay? So we anyway know that if someone's abdominal muscles are very, very weak, then generally their lower back is also having a lot of pain. Okay? The core muscles are used to keep that stability, to help prevent any kind of pain occurring. Pregnancy is another one. There is a tendency more to have pressure on the sciatic nerve, especially, and in pregnancy the lower back curves a lot more than normal for most women, so it's a lot of stress being put onto her spine. And especially if she had the tendency towards back pain and then she got pregnant, then there's a much higher chance that it's going to reoccur again. Then poor posture. So this tendency to hunch over and be on the computer, or these days there's even a name for it. I'm not sure of the name, but this thing with holding of the phone. And that people are always holding their phone and looking down at their phone, and they push their head forward and then they look down and the back is hunched too. Yeah. So these are all the problems of the new age of technology. So posture is a really important factor. How the person is walking, okay, having that awareness of walking correctly with the chest open and the head upright, not bringing the head forward, the chin forward, not rounding the back. Okay. A lot of this is just lack of awareness. Okay. And it also, a lot of it is affected by how they've been raised, also by their parents or by their teachers to stand up straight. You know, I remember my father would always make us walk with a book on our head. And this is old school style, but it was helpful, and stand up against the wall and make yourself straight. And he had the perfect posture, you know. But other people are not taught to do that. So their tendency is always to start rounding the back. So we have lots of thanks to give to some of our parents that were a bit strict in that way, because it's helped us with our habits from the beginning. Then there can be degeneration of the spine, okay, whether it's from an accident or trauma, or certain body types have a more tendency towards arthritic problems. It could be osteoporosis. We'll go into detail about that in a minute. But as you'll see this last slide, more than 80% of back pain doesn't actually have a cause. And these are especially the people that you're going to be dealing with as yoga teachers. They'll come to you, they've gone to doctors, they've gone to other types of practitioners, they've had scans, nothing is showing up, right? You must know someone that this has happened to, and they don't understand what's going on. Sometimes the pain changes, like it's in the lower back, then it moves to the upper back, then it's in the middle of the back, then it's in the neck, and it's always changing around. So for these people, we can help them a lot. Of course, we can help with the other things as well, but we're often the last resort. Like they've tried everything, okay, maybe I'll try yoga. Okay. But it is very interesting to see that there isn't a cause for a lot of this. And you can already start thinking, a lot of it's going to be mental stress, right? Even we know it. If we're feeling very, very tense, our upper back becomes tense, our neck becomes tense, then we start having headaches, things like this. Okay. Very common. So you would have already gone through the vertebrae, the natural curves of the spine that are there. Sometimes they can be exaggerated for certain people if they're having different conditions. You'll see in a minute. So we basically want to be doing the different practices that can affect the whole spine. Not only, say, the lumbar region, not only the cervical region, but the whole spine. And here you can see these little ligaments that are holding the spine together. They're different discs holding them together. These are what we also want to activate, which we can activate through twisting poses. That's why twisting asanas are so important in our practice, because we don't do twisting, right? Hardly ever. Like we just turn our body to the side, turn to the other side. We don't twist like this. So we need to start doing more and more of this twisting. Different types of twisting are there. And that will activate these ligaments more so that they start taking on a little bit of the load, as well as these large muscle groups. So these are some of the different conditions that one may have of the spine. Though, as I've mentioned, most people will have just a generalized back pain. Okay. Sciatica is very, very common. And we'll go through this. We don't need to have a look here. But here we'll look at the sciatica. Sciatica is where is pressure on the sciatic nerve. The sciatic nerve running down along the spine and then separating into two. Okay, going through the buttock, down the leg. So for some people, they'll have just a really mild back pain, that's all. For others, it will be very, very intense. And for many, it will radiate down their leg and even up to the foot. And if it's very strong, then they won't be able to walk even. They just have to lay on their side because it's so uncomfortable. Okay? It's very common, really, really common. And the treatment usually given is operation to try and take the pressure off the sciatic nerve. But the problem is, have the operation, still the habits are the same. Again, the problem occurs. So it's better if we can do other practices to strengthen the body to take that pressure off and keep the person sciatica free. I can say. A lot of people come to yoga because of back pain. A lot of people come because of sciatica. And if they keep up their yoga practice, it stays under control. Okay. So some of the reasons are the herniation of the disc, okay, where the disc is starting to protrude. Okay. Then you've got spinal stenosis, the narrowing of the spinal canal. You've got the piriformis muscle, which is just very handy if they have sciatica because of the piriformis. Then we can do many different stretches to stretch out that muscle. We can do massage as well, and that will take that pressure off. Okay. Muscle is always easier to manage than bones. And then we have pregnancy. So because of the pressure of the fetus on the spine, because of that curve in the spine, pressure is more. So you'll have a lot of people coming. Anyone here has sciatica?
I used to have it.
Yeah. Okay. Two. Very painful.
I couldn't do much.
Yeah.
For a while. Yeah, it's really hard.
Yeah. When you get a flare up, you can't do anything.
Yeah.
Yeah.
Can't even sleep.
Yeah, it's not comfortable. Nothing is comfortable. It's a very difficult condition. Yeah. And we've had many patients in our therapy hospital that are bedridden. Like they've even come on the stretcher to the hospital, and we've given them many different types of treatments, yogic and naturopathic, and they've had very good results. Like they can't walk, and they leave walking. That's a big improvement. You know, so we'll go through some of those treatments with you. Then we have spondylitis and spondylosis. So inflammation of the vertebrae. Okay, itis means inflammation. So if you see any word with itis, you know it's inflammation of something. Sometimes easy to understand, sometimes not. Okay, so here, very, very common in the neck region and the lower back. Okay, the tendency. Here, we've also got this ankylosing spondylitis. So you can see here, maybe you can't read it, but in the corner, here we've got the regular spine, then we've got this ankylosing spondylitis, which is considered to be autoimmune. You might not see so many people with this condition come into your class because it can be very, very painful, very uncomfortable for them, and it's very progressive. So they'll have pain, they might have a lot of numbness, they might have weakness of the body. Then we have scoliosis, quite common. You can check if someone has scoliosis by getting them to bend forward from standing position, and then you can run your fingers along their spine, and if it comes out to the side, then you'll know that scoliosis is there. If it goes straight down, no problem. But if someone has bad scoliosis, they know it. They don't need to be told. Okay. Many times it is congenital, okay, so they're born with it. And then here, different practices can help. Strengthening of the spine is especially helpful. Some people have a lot of good results also with side movements and side plank, especially for strengthening. And what can happen many times, if the scoliosis is very bad, they would have been given a brace for their back to try to bring the spine back into the correct position. Then we have some other types of conditions of the spine. We've got this scoliosis you can see on the left. In the middle is kyphosis, which is that rounding of the back, this hunchback kind of effect. And then we have lordosis, which is more of a curve in the lower back. Many people do this. They have this tendency to push the belly out. And sometimes they have both. They push the belly out and they round the back at the same time. Okay. So they just actually need to stand up straight, open their chest, relax their shoulders, and tuck their tailbone under. And then their spine will be fine. But it's hard for them to continue to do that because of their habits. The middle one, kyphosis, is often because of osteoporosis, degeneration here. So we have osteoporosis, that decrease in the bone density especially, and strength. And they might not know that they have osteoporosis until they fall over and break a bone and have a bone scan and get it checked. Okay. Very, very common after menopause, as there's less estrogen, but it can also be a side effect of other different conditions. Okay. I know my father, he had lung cancer and adrenal cancer. We didn't know, and someone gave him a hug, broke his ribs. And it was only then that they found out, okay, the adrenal cancer was leaking the calcium out of his bones into his blood. So he had this osteoporosis throughout his whole body. But then you wouldn't think of it. You know, the tendency is always the middle-aged woman that we think of osteoporosis. Of course, it can also be if their diet has not been very good, if they didn't have enough calcium, B12, so on. So you can see up here the healthy bone, how dense and compact it is. Whereas with the osteoporosis, everything is becoming very, very fragile and frail. Okay. They can still do practices. Yoga is going to be helpful for them. But of course, you're not going to go and get them to do a headstand or an arm balance or something where there's a possibility, like that tiny possibility, that they could fall out of it. Okay. Of course, exercise is really important for them. So how can yoga help our students, especially with back pain? Relaxation of tense muscles. I would say this is number one. Okay. And just a nice shavasana or a nice relaxation in a certain relaxation asana is going to be very nice for them. Okay. They'll immediately start to feel the benefits. Relaxation of the mind. Okay. We know that if the mind is tense, the body is going to be tense. So we need to be relaxing both. Okay. We're anyway always looking at body and mind with yoga. Then realigning of the spine. So sometimes if there's a little bit of a curve in the spine, or sometimes if one of the discs is protruding a little bit, we can help to get things back in order. Okay. Gentle traction. So like a gentle stretching. Example, even you just raising up the arms and doing Parvatasana. Nice gentle stretch of the spine. We do many different asanas. We'll talk about this next. Strengthening of the core. Again, many different practices are there for building up the core muscles. Strengthening of the smaller muscles to take away that stress on the large muscle groups. Also very important. Improvement of the posture. So this can be done as the teacher when you're getting them to sit or stand or different positions, reminding them how to be, reminding them how to sit correctly, how to stand correctly, and so on. Nice gentle stretching, just to relieve a little bit of tension that might be there. Okay. And then creating awareness in their yoga practice and in everything that they're doing. Okay. Sometimes it might be that they didn't know that they're hunching, or they didn't know that they bring their head forward, or that they bring their pelvis forward. And it just needs you telling them or reminding them sometimes, which will help them a lot. So here we want to think about treatment for someone that is having back pain. Now it's going to be very different if they have acute back pain compared to if they have chronic back pain. Okay? Here, if it's acute, like Ganda would have mentioned, the rest, ice, compression, elevation, RICE principle. One can do that. And then rest, majority, biggest factor to put in. Relaxation as much as possible. Okay. Then simple breathing techniques and yoga nidra. You want them to be able to relax as much as possible. Okay. So simple breathing will help them to relax more. Okay. Yoga nidra will help them to relax more. Doesn't have to be in shavasana. Okay. Shavasana can actually be a very uncomfortable position for many people with back pain. Okay. So then a different asana, makarasana, crocodile pose, or Matsya Kridasana, the flapping fish pose, can be done. Or Tadagasana, the pond pose. These are going to be very helpful. Shavasana, generally not very helpful. Many times it pulls, especially on the lower back or on the coccyx, the sacral region, it pulls. So it makes it worse, laying on the back. So we want to be able to build up to stretches over a period of time. But to start with, they need to rest, they need to relax, okay, as much as they can. Okay? And this means avoiding all of the daily activities that can cause them pain. Even sometimes they just recommended bed rest for so many days. Okay. Then, if it's chronic, we're starting with gentle stretches. Here, another thing to remember, massage, not always helpful in the acute stage, okay? Because if if the area is very, very inflamed and we do massage, then it can increase that inflammation. So that's why we don't want to be doing massage. That's also why we don't want to do too much stretching either, because it's increasing that blood circulation to the area. So that's where more rest is going to help. And if the body is very relaxed, then the body can focus more on healing. If the body is very stressed, then it's going to be using all that energy for the stress response, stress process. So moving to chronic, we start with the gentle stretches and the gentle movements and slowly build up. Okay. Here, supine position is very helpful, laying on the back. Okay. Not always with the legs straight, sometimes the knees are going to be bent. Doing the arm movements, the leg movements, the knee movements, all of these are done in supine position, so the back can relax more, okay? Because the floor is there as a support. Okay? Otherwise, if we're sitting up and we're trying to do a spinal twist, we need to keep a lot of our back active so that we can maintain the position. But if we're doing a supine spinal twist, it's very comfortable and relaxing for them. Okay. Next, they might do some chair yoga. Okay. Different type chair yoga, like, okay, we're bending our knee, we're twisting to the side, we're starting to raise our leg, lifting our leg up, things like this, chair yoga. We teach it in yoga therapy. Now, you've been told you're going to be given a USB, and in that USB we have all of our books. So yoga therapy books are in there. One of my therapy books, there's a big section on chair yoga. So if you have that interest, you can have a read. It's actually very helpful to learn some of these stretches and asanas in the chair, because not everyone can get to the ground. And especially if someone's back is really bad, they're going to be scared to go on the ground. You know? They'll be worried that they can't get up again. Okay. So that's why some of these movements, like these supine movements, they can do on the bed. So when when they can easily get off the bed again. Otherwise, getting right down to the floor is going to be too hard for them. Okay. Then we're going to slowly build up, after doing these movements, to start doing different asanas, different yoga poses, when they're ready. Okay. And we also want to be building the core strength. But here, if someone's got really bad back pain and you start doing leg movement, leg rotations and cycling and raising the legs up and down, it's going to be worse, right? So you're going to start just a little bit of building of the core and then very gradually increasing it. And as the back pain is getting better, you can slowly increase that core strength work. And both of them, of course, we need to create awareness of their movements, of their body, of their positions. So some different movements, the arm movements. Here, sometimes we do arm movements in standing position because you can get more of a stretch. Okay, so if they're comfortable to stand, you can do that too. Otherwise, supine position. Sometimes it might be that they can't lay in supine, so let them have their knees bent, like Tadasana pond pose, and then they can stretch the arms. Okay. Then we've got the leg movements. Now here you will see some variations in your book about having the other leg bent. So example, you want to raise the leg and rotate the leg. It can be very hard. So having the other leg bent, so the foot is on the floor close to the bottom, will take at least 50% of that pressure off. So it will make it much easier for them to do. Okay. Or if we want to do Uttanpadasana, raise leg pose, raising one leg up and down. Now for you guys, I'm sure you're all good at it. but think of the person with back pain. So it's very hard for them. So having the other leg bent will take that pressure off. And then when they feel comfortable, they can lower that leg down. Okay? So very gradual. Then we have the different knee movements. There's many different knee movements. You can check in the book. I think I've got about 7, maybe 8 in there. So different types of movements are there which can relieve the spine and stretch out the buttocks as well, which is also important. Then we have the different Palamukdasan Series 1. This is not specifically for the back, but what it is, Palamukdasan Series 1 is movements of the joints, all different joints. So we have like the wrists, we have the elbows, we have the shoulders, we have the neck, all joints. So this is very helpful if someone is not very flexible. You might want them to do different asanas for their back, but then their body can't cope with doing them because the joints are not free. So they need to do these simple movements of the joints and then go and do those asanas. Then we have different shoulder movements. I think you've learnt 2 in TTC. If you check in your book, you'll find at least 6 or 7 shoulder movements are there. So you can also incorporate them. Different neck movements are also there. So they've been practicing lots of different movements, and then we can start to add in the different asanas. Okay? Here, when you add in an asana, you want to get it checked with them. Like, okay, now we're doing cat pose. Is that comfortable for you? Is it feeling good for your spine? Starting to build up this relationship between them and checking also their awareness. Because what happens is someone goes and does a whole class and so many different asanas are there. They're not really paying much attention to their spine. And at the end of the class or the end of the 1 hour, they're like, oh, my back hurts. Not very helpful, right? So instead, they need to be aware of how is their spine when they're coming into the position, how is their spine when they're maintaining, and how is it when they come out. And then how is it feeling right at the end. Now, sometimes we don't feel it when we're in it, and then we release it, and then we're like, oh, my back hurts. It might just be a little bit, but it's there. So we understand that, okay, maybe when we do this position again, we need to either do a variation, or we need to come out of it in a different way, or we need to hold it for a little shorter duration. Okay? So this awareness is really important to build in our student with back pain. They need to understand what asanas are making them feel better and what is making them feel worse. Okay, next, the Vajrasana series. Do you remember it? A little bit. First week, it's gone. Vajrasana series is actually really helpful. Guruji formulated the Vajrasana series with many different asanas are in there, and we use it a lot in the therapy center. It might be that we just get them to do the Vajrasana series, hold each pose for as long as they can, then take some relaxation after, and again do the Vajrasana series. Okay? Some of the poses in Vajrasana series are very helpful. Okay? You might find they don't have a lot of time to do lots of asanas, but they can do a couple of them that they can maintain for longer. Okay? It's going to be really beneficial. We'll try to fit in a back pain class so that we also get a bit more revision of some of these asanas again. Okay, so the Vajrasana series, we have a simple series, the one that Guruji formulated, and then since then we've added some other asanas to it. You can check it in your book, Vajrasana series with variations. You will not do all those variations to begin with. Once it's very comfortable for them, then you can add those different poses on. Okay. Then we have Tadasana, palm tree pose, Tirak Tadasana, swaying palm tree, Kati Chakrasana, waist rotating pose. All these three, very good for the spine. Most people can comfortably do them. Okay. And they give immediate effect. Immediately the person feels a little bit better. Then we have Anandasana, Lord Vishnu pose. Okay. Do you remember that? Laying on your side, doing things with your legs. First week, it's in the timetable. Okay. Well, we definitely need revision of that then, because this Lord Vishnu pose is very important for the spine. Very, very helpful. In your book you'll find there's 6 types, but there's 3 types that are especially for the spine, and especially for sciatica, slip disc, for both of those. The best positions, Anantasana. Anantasana type 2 and 4 especially, very, very helpful. Then we've got Ardha Chakrasana. Ardha Chakrasana, the half wheel pose. Okay? Like the bridge, but we're lifting up. Now here, there's 3 types, but mostly you're going to start with the first type, which is where we're just going to lift the buttocks up and then lower them down. We're not extending the leg. Okay? We can extend the leg over a period of time when the back pain has decreased. If it's just mild, then they can go further. But if it's medium or severe, then it's only lifting up and coming down. That's all we want to be doing. So we can also do Khandasana, the bridge pose, where we're holding the ankles and lifting up, or just having the palms down and lifting up. That's also good. Okay. Then we have Ekapada Uttanpadasana, raising one leg up and down. Having the other leg bent will take the stress off. Okay. Tadagasana, pond pose. You all remember pond pose? So the knees are bent, we're laying supine, our knees are bent, the arms over the head. This is a very good position for the back. If everyone is doing Shavasana and someone has back pain, they'll automatically bend their knees to take that pressure off. Okay. So Tadagasana we can use a lot. We can use it for relaxation, we can use it for pranayama, simple breathing in Tadagasana. A friend of mine, she teaches back pain classes, and for the first 10 minutes of every class, she gets them to lay in Tadagasana and just practice breathing, just for 10 minutes, because it helps them focus, it helps them relax more, okay? And it helps them become a bit more in tune with their body. Okay? So you can also do that. Many times we do it with just awareness of the breath, laying in Tadagasana, one hand on the chest, one hand on the belly, starting to understand what's moving. This is very helpful. Okay. And then Yoga Nidra, relaxation, different asanas are there where one can relax more. Here, Shavasana is underneath with support for some, but not for all. Okay. Other positions, Matsya Kridasana, flapping fish pose. Okay. You haven't learned it, but it's in your book. And we'll go through it in the back pain class too, but you can also read up on these different positions because they're very helpful. Matsya Kridasana is where we're laying in prone position, we turn our arms like this, we bring our knee up. Okay. Many of you will sleep in that position, especially if you have back pain, because it will take the pressure off. Then we've got Advasana, reverse corpse pose. Very good to give a bit of traction to the spine. Okay. We have Jastikasana, superior pose. This is very good for the neck pain. Okay. And Makarasana, you all know Makarasana, the crocodile. Okay. So we can do the relaxation that we might normally do in Shavasana in one of these poses. Or we can do Yoga Nidra also in these different positions. You can experiment. Tomorrow when you do Yoga Nidra, try it in a different position. It will build on your own experiences and help you to become a good teacher if you've done it. In the prenatal course, we were doing Yoga Nidra in a different position every day, so they could have that understanding. You can even try it sitting up sometime. You can try it sitting in a chair, especially if you sleep all the time. Then it will just keep you a little bit awake, possibly. Okay, and then some other asanas that we can add. Majjarasana, cat pose, or Majjarasana. Very good for the spine. Okay. Vyagrasana, tiger pose. Then the variations of this, like raising one arm, raising one leg, raising both arm and leg to give traction to the spine. Okay. We have the Sphinx pose. So when we're doing the easy cobra, but we bring our forearms on the ground. Okay, very good. Shaitalyasana and variations. We do this in the practical class. Pawanmukrasana, gas release pose. Doing the full one, doing the half one, not lifting the head. That puts too much stress on the spine. Just keeping the head on the ground, sometimes rolling a little to the side, doing little circles to massage the back. It's very helpful. Needle and thread pulse. Here, we'll do this in class also. I can show you the chair yoga version where we're bending our leg, our ankle just past our knee, and bending forward. Okay. This will stretch out, especially the piriformis, okay, so the muscles in the buttock. Shashankasana, with lengthening of the spine, so walking the hands further away or bringing the hands into easy cobra, okay, to get more length. Very nice. Moon pose, I'll show you that one because that will be new. Parvadasana, the mountain pose. Okay, you do it at the end of your class. Gomukhasana, cow face pose. Many of you will know it, where we're crossing the legs over the other leg so the feet are out. Okay. Usually it's with the arms tied behind, but it doesn't have to be. Sitting position, sitting twists. So starting with gentle ones. So like Vakrasana type 1, and then building up to Ardha Matsundrasana. But of course, starting very, very simple. Okay. If you're trying to do the full Ardha Matsundrasana with back pain, it's going to make it worse. Okay, so we want to start with very simple variations and then increase that twist. But remember that we start first with supine twists. When they're very comfortable, then we can move into sitting twists. And then things like right angle pulse, which I'll show you. Ardha Shalabhasana, okay, the half locust position. Here we can use a support to start with, whether it's a cushion or a pillow or a chair, and then later we can also use our leg as a support. And when that's comfortable, we can do it without support. And then we're slowly building up to stronger types of back bends. Back bends are very good for the spine, but if someone has back pain, they have to be very gentle back bends. Okay? And then slowly, when the pain is decreased, we can increase the strength of the back bend. Okay? Like the different Bhujangasana series, you've done them now, right? Hands next to the ears, shoulders, also above the head, down at the waist. So this can help to stretch and lengthen the spine, the whole spine, different areas of the spine for different cobra poses. Ardha Ustrasana is the half camel pose. Not to be done when they have very strong back pain, but later they can do it. You know, if someone had sciatica and they've overcome sciatica, they can practice things like the cobra pose and the camel pose gently, okay? And that will prevent it from reoccurring. So preventative, here the next point, back bending, twisting asanas, stretching of the spine, strengthening of the core, and of course lots of relaxation, lots of stress relief to prevent their body seizing up again. Okay. So some other things that we want to be avoiding if we have the back pain. So any pose that is strenuous for them. It doesn't matter what kind of pose it is. You know, even if it's supposed to be good for the back, but if it's strenuous, they shouldn't do it. Okay? It's really important that they're aware of that. Second, any position that is causing pain, discomfort, whether it's coming into the pose, whether it's holding, whether it's releasing, whether it's after. Okay? Avoiding. If it's very strong. If it's just a little bit, then they can alter the position for next time. Like I said, decreasing the duration or taking a variation. Forward bending poses. Now, sometimes forward bends can be helpful. A lot of the time, they're not helpful. Sometimes you'll have a person with sciatica. They do forward bend, immediately they have more pain. It can also be how they're doing the position. Okay? If they're folding from higher up in the spine, then their back is going to be rounding a lot. Sometimes they can't fold from lower down. That's just how it is. And if that's the case, definitely avoiding the pose. Otherwise, lifting up the buttocks so that we're on the sitting bones, or even putting a little cushion under the bottom and then bending forward. And not rounding, just looking towards the toes, okay, looking straight. Then most of the time it's going to be okay, but still one needs to check. Now, especially forward bending with the legs apart can be the worst. Sharanagat mudra that you do at the end of the class, very bad if someone has back pain. Ugrasan, the ferocious pose, where you're bending forward and holding the feet, not good either. Ekapada Hastasan, where you're going to one side and the legs are out, coming forward, also not good. So sometimes the forward bends like Shashankasan or child's pose can be irritating if the head is down. If that's the case, having the head up. But for most, they do feel quite comfortable in those positions. It's usually when the legs are straight and they're bending forward that the problem is there. Then avoiding the strong back bends, as I've already mentioned. Oops. Then things like Sarangasan and Halasan, okay, is very bad for the neck and the upper back if the back pain is there. Okay. Also for the lower back, because we need to be maintaining the position, which is also tough on the whole spine. So avoiding it in those cases. Viparit Kani can be done if it feels comfortable, because there's not so much stress on the neck and on the upper back, but only if they feel comfortable to do it. Okay. Then we have things like Agnisa. Agnisa, do you know it yet? The fire breath, where the belly's going in and out. Yeah, it's strong on the back, okay. So it needs to be avoided. Udiyan Bandha also, very, very strong on the back. Yes, it helps with the muscles, but then it's too much stress on the back at the time. They can do it later, like once they've healed. And then Kapalbhati or Bastrika, both of them very strong practices, very strong on the spine. Okay? So they need to avoid it. Okay? It's not like they have to avoid these things forever. Okay? If they're practicing in the correct way, if they're doing the asanas that are going to help them, if they're very aware of what they're doing, then they can slowly introduce these things as the pain decreases. But one shouldn't just rush. Oh no, my back's okay, now I'll start doing 500 Kapalbhati again. Next day again, the pain will be back. Okay? We have to be very, very gentle with the spine. So I think that was the last slide. So we'll finish there. Hariom.